Pancreatic and biliary disorders, can now be managed mostly for a lot of conditions that were previously done by surgeons. Reflux is basically due to acidity. And if acid goes into your food pipe, it causes reflux, or it's called gastroesophageal reflux disease. There is a direct link, and it's very important to treat or at least look at that in patients who present with diseases of the GI tract.
Dr. Saad, can you discuss the recent advancements in gastrointestinal diagnostics and treatments? How have these innovations improved patient outcomes, and what emerging technologies or procedures are you most excited about?
One of the most rapidly advancing field of medicine today is gastroenterology, especially endoscopy. And I have seen the evolution from when we were using fiber optics and endoscopes to now what we call videoscopes. And introduction of different techniques and improvement scopes have actually enabled us to do a lot of things that were done via surgery through endoscopes now. So for example, pancreatic and biliary disorders, can now be managed mostly for a lot of conditions that were previously done by surgeons through endoscopes. Now we have endoscopic ultrasound, which is allowing us to do ultrasound from within the body, which allows us to do a lot of things again, diagnose, both diagnostic as well as therapeutic. Other than that, obviously we are able to pick up cancers earlier because of endoscopy, especially colonoscopy, and we are able to treat it endoscopically as well. Recently, we've also started doing gastric sleeve gastroplasty through endoscopy. So recently, we've also started, we have seen the development of endoscopic methods of doing bariatric surgery, weight reduction surgery, and anti-reflux surgery. So there is a lot that has been done and that has happened over the last 3 decades, and it's really interesting, exciting, where we are now able to do things as daycare, treat patients and then send them home the next day maximum.
Can you elaborate on the role of diet in maintaining gastrointestinal health? What dietary changes or recommendations would you suggest for individuals suffering from common GI disorders such as IBS, GERD, or Crohn's disease?
Healthy diet is helpful in almost all and is useful for all body parts, whether it's heart, liver, or whether it's the GI tract itself. So, on one hand, having good diet, with breakfast, lunch and dinner for patients who've got IBS, avoiding certain things that exacerbate their symptoms, avoiding late night eating, avoiding full meals, avoiding smoking, and a lot of tea and coffee would help patients who've got irritable bowel syndrome. Again, fiber in their diet. Now, what has happened is over the last couple of decades, our diet is now fast food, and which is not good for our liver, neither is it good for our gut or heart. So I think balanced diet is very good. The other thing that you mentioned about the reflux is basically due to acidity. And if acid goes into your food pipe, it causes reflux, or it's called gastroesophageal reflux disease. Now, in reflux, you need to avoid spicy food, you need to avoid fatty food, fried food, and again, coffee, tea, smoking all play their role. One of the things that's very important is avoiding you know, stress, and making sure that you have good night's sleep, because they also have a good effect in patients both with IBS and GERD.
The gut microbiome has gained significant attention in recent years. Can you explain how the microbiome influences gastrointestinal health and what steps individuals can take to maintain a healthy gut microbiome?
Okay, that's an interesting thing. A lot of work has been done in the recent years on gut microbes. And what we have learned is that you have friendly bacteria which are very useful for the functioning of your gut. And when you have repeated infections or you take a lot of antibiotics, you're actually going to get rid of them as well. And in patients, especially in people who have recurrent problems with their diarrhea or become more sensitive to certain foods or get more sensitive to infections, they would benefit from having the drugs that contain those microbes. They are available easily, and you need to take them for some time for them to be beneficial. They're also useful in patients who've got colitis sometimes. And so I think overall, again, it's about healthy lifestyle. So when you maintain your healthy lifestyle, meaning you avoid food that is contaminated or causing infections, especially in our part of the world, or repeated use of antibiotics would actually make things worse through eradicating your friendly bugs.
Stress is known to impact gastrointestinal health. Could you discuss the physiological mechanisms through which stress affects the GI tract and provide strategies for managing stress to improve GI health?
Brain-gut axis, the connection between your digestive system and brain, is now well known. A lot of research and work has already been done on it. What we understand is, for example, in patients with irritable bowel syndrome, stress plays an important role. Patients, especially young female, would be coming with vomiting or regurgitation of food, again quite often related to mental conditions leading to gut issues. And there is a direct link, and it's very important to treat or at least look at that in patients who present with diseases of the GI tract. And hence, we are now quite often have to use antidepressants, which have a positive effect on patients who have not responded to routine treatment with, for example, irritable bowel syndrome, or even in upper GI issues, which are functional GI disorders.
Preventive measures and early screening are crucial in managing gastrointestinal diseases. What are the most effective preventive strategies and screening practices you recommend, especially for high-risk individuals?
So I think this is a very important topic, especially for our part of the world, where a lot of symptoms that are very important are ignored. The symptoms that must not be ignored are vomiting, pain that wakes you up at night, severe pain, obviously that requires you to go to the hospital, must be investigated, blood in stool, diarrhea that is persistent, or is with blood in stool. These are things, and weight loss, these are things that must not be ignored. They are suggesting that there is something wrong and you must contact the doctor, whether it's a gastroenterologist or a physician, to actually work you up. And quite often you'll end up requiring, if there is problem with swallowing, then it would be upper GI endoscopy, or if there is blood in stool. I think in Pakistan especially, blood in stool is ignored a lot, and a lot of people think blood in the stool only comes because of piles or hemorrhoids. And that's wrong. Even if you have hemorrhoids, we recommend that you should have an examination of your colon. I've seen a lot of cases which were supposedly treated as hemorrhoids, and then we found that eventually they ended up having cancers, and by the time we picked them up, they were not treatable. And if they were picked up early, the first sign, then maybe they would have been treated.